friends, and good morning, good afternoon from people joining this live webinar from India on behalf of Indian Cancer Society, Delhi branch. Today, I'm having fabulous and fascinating opportunity to welcome Dr. Rajendra Toprani, a dear friend of mine. I'm having acquaintances with him for more than 20 years. And apart from being a head and neck surgical oncologist, he is a wonderful human being and doing a lot of charity for cancer patients and whatnot. And on top of that, apart from being surgical oncologist, is one of the best administrator I have seen, where he can deliver things without any kind of stress, and he can make things happen. So I must say he's a living example with the combination of a surgical head and neck surgical oncologist as well as commendable management guru, and currently is the president of Academic Surgical Oncology of India, past president, and is having massive experience in academic surgical oncology for past 28 years. He has been trained at various and renowned cancer centers like MSKCC, that is Mount Sloan Kettering in New York, in Germany, and several other institutions all over the world. He has delivered number of keynote talks globally, and yes, he has given life to individuals, rather head and neck cancer patients for last 28 years. So, sir, welcome on board, and floor is all yours to proceed. And thank you very much for giving your valuable time today to share your experience and expertise with the public. Thank you.
So, thank you very much, Shrenik Bhai, for having me on your very famous webinars. And I understand this is the second in your series that you have started. Thanks for inviting me on your webinar, and also thank the Indian Cancer Society Delhi branch, the officials of Indian Cancer Society Delhi branch, to have me on your program. I would welcome all the participants and the listeners to this webinar. So before we start this, I was told that the participants usually would be non-medicals. So I would restrict my talk about the contents in that context. Let me just begin by saying that tobacco consumption in India is a big problem. And one of the main reasons for our today's topic is oral and laryngeal cancers. So the main etiology for oral and laryngeal cancer is consumption of tobacco in any form. Let us first talk about the oral cancers. So India is considered to be the world capital for oral cancers. And the reason is the consumption of tobacco is rampant in almost all the states of our country, from north to south and west to east. Wherever you go, you'll see this very attractive tobacco pouches and even sopari, that is areca nut. So very few people would know that even areca nut consumed every day, if you are addicted to areca nut, that is sopari, then also it can cause oral cancers. And this is what we need to make people aware about it. Now, this tobacco is consumed in India in different states in different ways. In Gujarat, for example, it is consumed along with the betel nut or uh, the what you call the pan or gutka, and gutkas are now banned in most of the states in our country, but still available in the black market of market, the gray market. So that is where we need to have more strict policies from the government, and they are trying their best to see that people are being made aware, and the consumption of gutkas and everything is used. What it does is it has carcinogens, and it causes intense chemical reactions in the oral cavity lining, and it causes submucous fibrosis that leads to trismus, that is difficulty in opening the mouth. So you will see the chronic gutka consumption people, they cannot open their mouth fully, and that is called submucous fibrosis. So that is a very common condition seen in our country. And this cancer is very typical of the Indian subcontinent because in the West, they don't consume so much of oral tobacco and gutka. So they don't see this kind of cancers, the buccal cancers or the alveolar cancers, the what we call the gingivo-buccal group of cancers. Cancer doesn't start overnight. It gives some warning signals to begin with. So the first sign or symptom of cancer is they develop the white patches in the oral cavity, that is either in the buccal mucosa, that what we call as cheek, or in the tongue, or in the tongue. So there's white patches are called leukoplakia in medical terms. So this leukoplakia could be heterogeneous or homogeneous. So it develops slowly, and then over a period of time, it progresses to erythroplakia, that is called a red patch. Again, that red patch could be heterogeneous or homogeneous. And then subsequently, there is a development of invasive cancer. So the uh, cancer will not develop overnight, as I told you. It takes couple of weeks to develop from leukoplakia to erythroplakia, which is a pre-malignant condition, and it progresses to invasive cancer also. It takes some more weeks. So if we diagnose this cancer in early stages or even before the cancer has set up, if we diagnose and treat these patients in that stage, in early stage, we can give a very high cure rate for such patients with less of morbidity, less of surgery, and good functional as well as cosmetic outcome. So it is important for the patients who consume tobacco in any form, if they develop any of these signs or symptoms, to contact their doctor or the surgeon or the cancer surgeon in their vicinity at the earliest, get it diagnosed at an early stage, get appropriately treated, appropriate surgery uh, in the right time, and this will lead to a higher cure rate. So the problem in our country is education, or the lack of education and the lack of awareness. We need to make people more aware what causes this cancer and what are the warning signs of these cancers. And the second problem is accessibility to the to tertiary care cancer hospitals or the specialists. 20% of the population in our country is still in the rural areas. So for them to contact the tertiary care cancer centers in the cities is difficult at times. And that is where we need to develop a hub and a spoke model for diagnosis of common cancers. And oral cancers is one of the common cancers in our country. To give you an idea of the load of this cancer in our country, for example, on an average, we see around 1.5 million, that is 15 lakh new cancer cases in a year in our country that are notified officially. But there may be so many thousands of other cancer cases which are not notified or not brought to the notice of the authorities. So the cancer burden may be much more than what is published in the literature actually. Out of these cancers, at least 10% are head and neck cancers which are attributed to tobacco chewing or tobacco consumption in any form. And so you can understand the load of these cancers. And more importantly, this 1.5 million cancer cases are diagnosed, half of them or more than half of them are diagnosed in stage 3 and 4. And that increases their mortality and morbidity. So, 50% of the patients will not live for next 12 months or 24 months after diagnosis. That is very unfortunate. Now, the same kind of cancers are 70% are diagnosed in our country in an advanced case, but in the West, because of good education and awareness, the same cancer cases, 70% of them are diagnosed in early stages, that is stage 1 and 2. And that is why the results that you get in those patients in those countries are good because they are diagnosed and treated at an early stage. This is very important. Now, if you agree, Shrenik bhai, I can show you some photos of this pre-malignant conditions and how does cancer look like in oral cavity. So let me just see if I can share this.
Yes, sir. Please go ahead.
Okay, so can you see the slides?
Yes.
Okay, slideshow. So this patient, this white patches that you see here, this is the leukoplakia. They are known as leukoplakias, and these are pre-malignant conditions. So any person who is as tobacco consumption, consuming tobacco orally, chewing tobacco or smoking, if they develop this patches, they have to be aware and they should see the doctor immediately. The second slide is about the erythroplakia. So the leukoplakia progresses to these red patches, which can be homogeneous or it can be heterogeneous. So this is another step after leukoplakia. And in this patient, you can see uh, uh, the progression of leukoplakia to invasive cancer, how it develops progressively. And this is the patient where he has developed submucous fibrosis. So he cannot open his mouth fully because of the submucous fibrosis involving both his cheeks. And this is the patient again with a leukoplakia on the tongue. And this is then developing into cancer at a later stage. So if you ignore these signals, it can progress to this stage of the cancer, which is a serious condition. And this particular slide I have shown because I wanted to show to the audience that it is not only the tobacco that causes, 98% of the times it is tobacco or alcohol combined together can cause oral cancers. But sometimes ill-fitting dentures or sharp teeth that causes friction every day, this can also be a cause for developing cancer in the oral cavity, either in the buccal mucosa, that is cheek or the tongue. So this is a classic example of a person who is not a tobacco addict developing cancer on the tongue because of his oral hygiene and the sharp teeth, as you can see. And this is another common cancers that we see in India. And this is involving the cheek and the lower bone, lower mandible, jaw bone, that is what is called as mandible. These are the common cancers and the conditions that we see in our country. Now, let me stop sharing. Okay, can you stop sharing this? Okay. So uh, the thing is, once you diagnose these patients, you have to see uh, uh, you have to see a competent cancer surgeon to do a biopsy, and then he will do whatever appropriate imaging is required for these patients, and appropriate surgical treatment is planned. So stage 1 and 2 are treated. Before that, let me talk about biopsy, because there are a lot of misbeliefs in our country. Some people, when we advise them biopsy, they think that by doing biopsy, the disease will spread all over the body. That is wrong. That is a wrong belief. And we need to educate patients for that. Because unless we do a biopsy, we cannot diagnose this cancer. And the biopsy is a simple office procedure under local anesthesia. We take either a punch by a forceps, by a biopsy forceps, or we take a small incisional biopsy with the knife or something, and we send it to the laboratory, and within 24 to 48 hours, we get the biopsy report. Now, it is important to do appropriate staging for this patient, investigations for this patient. That might include a CT scan or a MRI or even a PET scan in certain cases, where we understand what is the spread of the disease in the surrounding tissue and what is the spread of the disease in the neck nodes or anywhere else in the body. According to the reports, a stage of the disease is established, and then the treatment is planned by the surgeon. Now, for stage 1 and 2, it is appropriate surgery that is the treatment required. A single modality treatment is required for such patients. So, surgery alone itself is enough. In very rare situations, we treat these patients with radiation therapy, particularly those involving the lips. We treat these patients with radiotherapy because it is difficult to reconstruct the defect once the resection is done for the lip cancer. But the common cancers are the buccal cancers and the tongue cancers. We treat them by surgery. Now, stage 3 and 4 cancers, after surgery, we treat them with radiation therapy in an adjuvant setting. So that is called post-operative radiation therapy, adjuvant. And the surgery is typically involving removal of the disease, the primary disease, and appropriate neck dissection, removal of the lymph nodes in the neck that are involved, and then whatever defect is there, we need to fill in the defect, we need to reconstruct the defect, and we do what is called as a plastic surgery by doing some flaps which are commonly done for reconstructing this plastic these defects, and give a good function and give a good cosmetic output for this patient. So sometimes the patients are given a rice tube feeding for a couple of days or weeks, and once the wound is healed, we start them on oral feeds, and the radiation therapy, if at all it has to be given, it is started within 4 to 6 weeks after surgery. And once the radiation therapy is over, the patient comes for regular follow-up in our clinic. And the first 2 years are very important. First of all, they have to stop their addiction. We ask them, we counsel them to stop tobacco, alcohol in any form. And they have to come for regular checkup in our clinics. And if they develop a recurrence, it has to be picked up again at an early stage and appropriately treated. So this is in short about the oral cancers, and the typical biological behavior of this patient is very important to keep them in close follow-up for next post-operatively for next 2 to 5 years. And yeah, after 2 years, typically we ask them to come for follow-up every year, because there is a chance for them to develop a second primary cancer, and that happens in 3 to 4% of patients every year. So this is all about the common information about the oral cancers that I have told for the audience. Do you have questions for oral cancer, and then we go for the laryngeal cancer, or how do we do about it? You are muted. Shrenik bhai, you are muted.
Yeah, sir. I certainly would like to ask some questions, and maybe we might have some questions from audience as well. So, see, you very well and remarkably mentioned about the consumption of tobacco, and this is rather, alarming situation, particularly in India. On this note, sir, I would like to add one point that this is my 27th year after larynx cancer, but fortunately, I have never consumed tobacco in any form, and I believe that you have very rightly mentioned that if you have not consumed the tobacco in any form, then survival rate or leading second life to zero is quite easily possible. On the other hand, one more point I would like to add here that we are celebrating No Tobacco Day once in a year, but ideally, particularly in India, we should celebrate No Tobacco Day every day because this is taking the toll of life. And I want to add one more point here that simply by consuming tobacco, particularly by male community, you are penalizing the family members for their no fault of theirs, be it your wife or be it your children. So tobacco consumption must be stopped forever. So this is all I just wanted to mention about kidney cancer topic you mentioned,
You
and
you brought out
we are
you
very
you brought out a very important point, Shrenik bhai, that this is a preventable cancer, and this is mainly because of the tobacco. So our focus is mainly on youngsters to uh, persuade them not to consume tobacco, to make them aware about the ill effects of tobacco. So apart from cancer, tobacco can cause so many other problems in other organs of the body. Now, what we have seen over last 30 years, I have been practicing. What we used to see these cancers in the fifth or the sixth decade in the males. Now we see these cancers in second or the third decade of these patients because they start consuming tobacco at the age of 12 or 13. In Gujarat, particularly if I can talk of Gujarat, in areas such as Saurashtra or Kutch, the youngsters, the boys, they pick up this tobacco habit at an early age of 12 or 13. And by the time they are 20, 25, they get this oral cancers or submucous fibrosis, the picture that I showed you. And it's a very debilitating problem for them at that age. They are young, they are not earning, they just recently started a family, they are not economically established, financially, they are not established. So it's an emotional problem, it's a psychological problem, it's a financial problem, they don't have insurance, and the cost of this treatment is not cheap. So this creates a lot of problem for the family, as you said, very rightly, for the wife, for the spouse, for the children, and even females in well-to-do houses, in educated families. They have started consuming a lot of this supari, the one that is endorsed by a lot of Bollywood stars. And we have written letters to them as well as some of the sports personalities also not to endorse this brand because they are the role models in our country. And the youngsters in our country, they follow the role models in Bollywood and in sports. So this is a big problem. Creating awareness is a big issue, and these are preventable cancers, mind you. So if people can stop it, I'll give you one statistics in Gujarat. Almost 60% of the population is addicted to tobacco. That includes males and females and youngsters. It's a big issue in Gujarat also. Gujarat, out of the whole country, I think Gujarat has got the highest number of oral cancers. So we have to take this seriously, and the Ministry of Health has started a campaign, no tobacco campaign, and we are trying to create awareness. And I hope our whatever we are doing can help the youngsters in next 2 or 3 decades at least.
Doctor,
And
I have a question. Yeah,
Yes,
may I? Yeah. So it's like this, like about 6 months back, I was visiting my dentist for some treatments, and my treatment had been going on since last July. And then in severe winter, I stopped the treatment because I cannot take the severe winter here in Delhi. So once I resumed it in early March, so she suddenly said, when she opened the mouth with her tools and whatever, that ye kya ho gaya? So then she told me that you have a pre-cancer condition. What she called was Lynchian planus. Now, what is that exactly? Though it has uh, kind of healed or reduced a lot, because I went through a detox program, and I don't take any tobacco and I don't take any alcohol. The only thing I take, which could be somewhere nearby, which is
are you
tea.
diabetic?
Yeah, I'm diabetic.
Okay,
I take
and
tea.
any
Now I take black tea.
are you an immunocompromised person? Do you have lack of immunity because of some reason?
I don't think so. Diabetes also was detected about 2.5 years ago only. And asthma, allergic asthma I have. That's it. BP I have. But is Lynchian
Do
planus
you
something?
do you take steroids for your asthma?
No.
No. So anyway, so lichen planus, these conditions are usually diagnosed by the dentists who are smart enough to diagnose these conditions, and they would guide the patients to either seek an advice from a competent oral or a head and neck surgeon or an oncosurgeon. And this is certainly a pre-malignant condition, but it is treatable, it is reversible. So you need to
I
be aware of that. You need
but
to
it
be
has gone. No, it was quite a bit, and I've been taking pics. He takes the pics, so it has come down quite a bit from in the last few months. And I was taking lycopene and a lot of detoxification from the food angle also to increase
correct.
antioxidants. But if it goes down, does it come back again?
It can come down. So what you need to make sure is you maintain your oral hygiene, number one.
Uh,
Number two, you should make sure that you visit your dentist regularly, if you particularly if you have sharp and irregular teeth and caries teeth. Or in a very bad oral hygiene also contributes to development of oral cancers because of these pre-malignant conditions, lichen planus and all. This you should treat, be in regular follow-up, and there's no need to panic, because most of these cancers are reversible, or most of these lesions are reversible, and you have to be aware of progression of these lesions. And if there is a progression, you need to do an appropriate biopsy at the right time. That's all.
Yeah. I also showed to a dentist who has specialized in Lynchian planus, and she also said that there is, at the stage when she saw it, she said that it is not in a stage where you even need a biopsy now. Maybe it was there earlier. So,
Correct.
but I'm just concerned that does it come back, or am I healed? Like,
Very it once it subsides, once it recedes, it's
uh,
very unlikely to come back. But you have
uh,
to be aware. It's not that it can never come back, because there
okay,
were conditions because of which you had it, and those conditions can be repeated, and then you can still have that condition again. So you
okay,
just need to be aware. What we need to do is to take simple measures in life. There is no need to panic, but you need certainly need to be aware of that condition.
okay. And doctor, where are you based? You are in which city?
I'm in Ahmedabad.
Okay, okay. Thank you.
Well, well,
I have
sir,
a question, doctor. I have a question.
Yes, ma'am.
Yeah. So I'm asking, as you just discussed tobacco, so what are the primary reasons for the failure of in implementing tobacco control policies in Indian effectively? Because you know what happens, what I have seen, whether you get anything to eat or not, but a 10-year-old or 8-year-old can definitely buy gutka packets or those candy packets. which, if you're 10-year-old, 7-year-old can go and buy it from anywhere. So there are no laws to restrict them that, even for smoking or drinking, there are some laws, but not for this tobacco consuming in form of gutkhas and all. So what is that we are lacking and what is that we can do about?
Very good question, ma'am. And the government of India is doing a lot to implement the ban of gutkhas. I think majority of the states in the country have a ban on sale of gutkha, but obviously they are available in the gray market. And now the tobacco consumers, they are very smart, so they know how to mix the areca nut, the supari, the flavored supari, which has got different chemicals, which is also carcinogenic, and they just mix it with tobacco because nicotine is a substance that gives them addiction. So they mix tobacco and this flavored supari, and they make their own gutka, and they, sort of continue chewing tobacco accordingly. But there are strict laws. They cannot be sold in open market. As far as cigarettes are concerned, there are strict laws for that. If you have seen a cigarette packet, there is a very bad picture about a cancer patient or something. And this is to warn even the uneducated person. But even after that, I think there is some slowdown in the sale of cigarettes in our country. In USA, it has definitely reduced. The smoking has gone down, and it has reflected in the incidence of laryngeal cancer in the United States of America. In India, we are still 10 years behind the USA, and I think after 10 or 20 years, this ban or the policies, anti-tobacco policies, will definitely make an impact on our incidence of cancers in the country. Talking about cigarettes, let me talk to you about the e-cigarettes also. Even the e-cigarettes, they are banned in our country. There is a law; it's not available, but still in grey market it is available. Now that has also shown an evidence for causing cancer. So that is why the government of India has banned it. Now all these things right now, last week only I had a meeting with the DGHS, Ministry of Health, Dr. Atul Goyal and other people, and they are doing their best to educate through all the associations, medical associations in our country, for creating awareness about tobacco and its menace. Tobacco in any form is dangerous. There are a lot of hookah bars in your city. If you are from Delhi,
Yes.
so there are a lot of hookah bars that are also banned. But still, things go unnoticed, and the youngsters don't realize it right now. Particularly when you combine tobacco with alcohol, the risk of developing the head and neck cancers, it multiplies. So that is very unfortunate. So those who smoke or chew tobacco are in high risk groups. And what we tell those people is, at least use, even if you stop this tobacco addiction, you must see your cancer surgeon or your dentist or whoever the doctor whom you are following. Even after stopping your addiction, you must see, because you fall into the high risk group of developing these cancers in
That's
near
fine.
future also.
So that's fine. But my question was that there are no such laws which are, as you said, they are available in gray market. But
No, there
I
are
find
laws. There are
every nook
laws.
and corner of
There are
Delhi.
laws. So in around the schools or educational institutes, beyond after 200 meters, I think they cannot sell tobacco products. So gutta is banned, but they can sell raw tobacco. That is a catch. So they sell raw tobacco, and then they sell this very
Exactly.
fancy.
The tobacco is tobacco, whether it's in any form. So there is no such law I see
No, there is
where,
no such law for
yeah,
the. Yeah,
yeah,
you
that's
are
what
right.
my,
The law
yeah,
is for
Uh,
gutka. The law is for gutka.
yeah. And
um,
yeah,
sir, sir, I would like to add my thoughts to the question of Miss Tingra. Say, I mean, you mentioned about celebrities, you mentioned about the companies who are selling such kind of stuff like tobacco, somebody and everything. See, what happens is you know, I mean, practically every single individual, I mean, particularly in a adult or other after teenage, everybody's using smartphone. They are smart enough to use smartphone, but they are not smart enough to stop consuming tobacco. That is the problem. Say, I mean, the government will do everything. There are institutions, there are NGOs, everybody's protesting about this, causing awareness, etc. But unless and until you don't adapt the situation by yourself, and let's not forget, not a single celebrity, not any one masala producer is going to support you for your cancer treatment, even for a single penny. So, we need to understand by ourselves that, we need to stop consuming tobacco. So, importantly, it is all about self awareness. And I mean, say government will be taking its own time. They have 100 things to do, but then if we manage it ourselves, if we control it ourselves, I think we can do
Yeah,
we can have
it is
better
our
results.
responsibility as an educated person in a society. And
Exactly,
one of the things
exactly.
that we are doing on personal grounds, what we do is we approach the high school students. We go to the schools. That is the best time we can catch hold of these youngsters in the schools, and we educate them about tobacco and cancer. And it has two aims. Number one, the children themselves get aware. Number two, if their parents are also smokers or tobacco chewers, they go home and tell that their parents also that dad, you have to stop chewing tobacco, or dad, you have to stop smoking tobacco. So this is where we found that there is a bigger impact if you go to the schools and educate the children at that age in the high school.
So
Once they are in,
as NGO, we do that. We go to schools, we go to community, we have awareness talks with them. But what I see when we go to this community where there are laborers and all, and maybe that kind of people, I think 98% people
you are
are
right. You
those
are right.
tobacco.
I think you are absolutely right, and we have an exhibition for this kind of people living in slums and other areas, and we have this mobile van, and we show these pictures to them, and just make them aware that what
पापा
it can
तुमको
cause.
भेजा था सुबह लिंक ना सुबह लिंक भेजा था ना ये सुनो yeah yeah
So I think we can go to the second part of the laryngeal
yeah
cancers, Shrenik bhai.
yeah sure
So laryngeal cancers is what is larynx? Larynx is the voice box from where our voice is produced. So it has two vocal cords, and when we speak, the vocal cords they move and they modulate our voice, and the tongue helps in the pronunciation. So larynx is an area below our tongue, and it is connected with our food pipe also behind it. So it's a very critical area. And the laryngeal cancers, the advantage of having a laryngeal cancer sometimes is that it can cause, it can help in early diagnosis, because the first symptom or sign of laryngeal cancer is the change in the voice. So if patients develop hoarseness of voice, if their voice becomes hoarse, and if it persists for more than 15 days or 1 month, we have to be aware, particularly if the person is a tobacco chewer or a smoker. And they need to see an appropriate surgeon, doctor, or ENT surgeon, or whoever is accessible to them. And they must get a biopsy done for a suspicious lesion on the vocal cords in the larynx. And after the biopsy, the treatment has to be planned. Now, unlike oral cancer, laryngeal cancer is different in the sense that it is not seen from outside, but you need to do an endoscopy in your office to see the laryngeal cancers, and everybody will not have that facility. So you need to find out a center where you have got all these facilities. Again, it has got stage 1 and 2 and 3 and 4. Now, for stage 1 and 2, in oral cancer, you remember we would treat with surgery for stage 1 and 2, while in laryngeal cancers, we treat them with radiation in stage 1 and 2. The reason is we want to preserve the organ, we want to preserve the natural voice. And in very rare situation, in very selective patients, in stage 1 particularly, or even in some selected stage 2 patients, we treat them with endoscopic laser surgeries. So we put an endoscope in the throat for the patient under general anesthesia, and we remove that cancer with a CO2 laser through a microscope, and it's a very precise and an accurate operation. So the patient doesn't need to be in the hospital for more than 24 hours, and he is discharged in next 24 hours, and there is no need to put a rice tube, feeding tube, or even do a tracheostomy for these patients. So these are the advantages of getting technological advanced machines, and the technology is advanced so that we can now diagnose these cancers at a very early stage. Sometimes we do a stroboscopy, we find out how deep is the cancer in the vocal cord, and accordingly we design the treatment in our clinics. For stage 3 and 4, most of the patients nowadays would undergo a treatment without surgery, that is chemotherapy and radiation, and there are different combinations available for them. We sometimes give chemotherapy and see how the patient responds. We treat them with upfront radiation along with chemotherapy if required, and in selective patients, we do surgery in form of laryngectomy, and we remove the larynx, and then we rehabilitate their voice either with an electrolarynx that Shrenik has been using so efficiently. And I've yet to see a patient who uses his electrolarynx as good as Shrenik. And he has counseled so many of our patients himself. And he's a uh, great boost of energy for our patients. Once the patients see him, they are just reassured that they will be living an absolutely normal life in post surgery. So that is about the laryngeal cancer. So again, laryngeal cancer has got a lot of functional repercussions, and that is where we need to diagnose these patients at an early stage and try to conserve the larynx if possible. So any questions on laryngeal cancers, we'll be happy to answer. Yes, Shrenik.
Sir, I am always concerned about the treatment protocol of laryngeal cancer, and particularly be it first stage, second, third, or fourth. I mean, of course, the surgical oncologist would always like to preserve the vocal cord for the patient, but then what are the chances? I mean, if the patient is given chemotherapy or radiotherapy and vocal cords are preserved, but then what are the chances of recurrent cancer? I mean, without undergoing surgery, that means given radiotherapy and chemotherapy combination or whatever. So, what are the chances of recurrent cancer while preserving the vocal cord?
So there is no controversy usually for stage 1 and 2 cancers. They are treated either by radiation, or if, wherever there is an expertise and infrastructure and technique and technology available. Like I have been trained in Germany for doing an endoscopic laser surgery, and I do a lot of endoscopic laser surgeries, but these are for very early laryngeal cancer, stage 1 or stage 2. The controversy is for stage 3 and 4 cancers. So nowadays, in last 3 decades, the treatment paradigm the whole paradigm has shifted from surgery to non-surgical treatment. So earlier we used to do a lot of surgeries for these cancers, and nowadays for very selective patients we need to do surgery, and those patients are where the cartilage, the thyroid cartilage or the cricoid cartilage, which is the framework of the larynx, the organ, if they are involved by the tumor, by the cancer, then we have to do the surgery by force, by compulsion. And that is the indication for doing upfront surgery. The other indication would be if it's an advanced cancer, even though the skeleton, the bones are not involved in the cartilages are not involved in the laryngeal framework. But if the larynx is not functioning, if the patient is aspirating, cannot swallow properly, then he would not respond to non-surgical treatment. And it is better to get his larynx out and give him a good quality of life. And the cure for surgery versus non-surgical treatment is almost the same. The issue is when we select the patients for non-surgical therapy, we have to be pretty sure that they will respond well to the treatment because 30 to 40% of the patients will not respond. And then ultimately they will need to undergo surgery. And the surgery is technically very challenging and leads to a lot of complications if I have to operate a patient after radiation and chemotherapy. So that is why selection of patients upfront is very important. And we have our tumor boards where we see the patients together with our radiation and medical oncologist and a dietitian and a speech pathologist. And we decide whether this patient is more likely to benefit by non-surgical therapy or he will benefit by surgical therapy. And then we discuss with the patient depending on his choice also, whether he's educated, uneducated, what are his preferences, what is his socio-economic condition, what is his background, what is his financial support, what is his family support. All these things, they end up in making a joint decision. But the selection of the patients, as you have rightly said, is very important. But to answer your question specifically, the results of oncological results, outcome long term, are the same in both arms, but only 60 to 70% of the patients will respond to chemoradiation, and 30 to 40% will still have to undergo surgery. Somebody wanted to ask a question.
Yeah,
Who is that? Kaushik? Go ahead.
Mr. Shri Kaushik wants to ask a question. I
Yeah,
don't
please
know
go
if
ahead. He is muted.
he's muted. Yeah.
So till he is ready to ask a question. Again, the rehabilitation part in laryngectomy, post laryngectomy is very important. Like you have seen Shrenik by using an electrolarynx. In some patients, we nowadays use the tracheoesophageal puncture, the prosthesis, where the patients have to use their thumb and then they can speak a natural voice and without using this electrolarynx. And nowadays, there are some hands-free processes devices also. So I think Sri Kaushik is ready for a question. Yes, please go ahead.
Sir, my husband has been diagnosed with cancer of the vocal cord, stage 3. He had his biopsy. He underwent 6 rounds of chemotherapy, then 30 days of radiation with chemo every week. Unfortunately, now his esophagus is closed. He cannot swallow at all.
Okay. So are you in Delhi?
I'm in Delhi, yes.
So is his cancer cured?
Yes. The PET scan said he's cancer free.
Okay.
And
And
but there is no swallowing.
may I ask which center you have taken the treatment?
We are getting it at the Artemis Hospital from Dr. Shashi Dhar.
Okay. So this is one of the known complication of this kind of treatment. This is called a stricture, esophageal stricture, or the post-cricoid stricture. And this can happen because of this aggressive chemoradiation. And this is known to happen in some percentage of patients. So it is not unusual to have this kind of thing. Important thing is how do you manage these patients? So sometimes in an early stage, if it is diagnosed, we can do an endoscopy and dilate this stricture and keep on dilating till their benefit. Once they stop having the benefit and once the dilatation requires more frequently, we can think about, unfortunately, to do a surgery on these patients and remove the larynx and give a good, meaningful life to these patients. But that is going to be a difficult decision for you all. So you need to discuss with your surgeon whether he can treat this by endoscopically dilating frequently. And I don't know whether you have undergone any dilatation till now.
Yes, doctor, they have made an attempt of ballooning it, but they were not able to do it. The last endoscopy they did was last Tuesday, and they said the esophagus is all right, but there is a lot of swelling. There is no drainage of the lymph nodes, and the swelling is so much, even his saliva and the mucus generated doesn't go in.
Yeah. So it's a difficult situation. And I'm sure they must be giving a feeding to him through a percutaneous gastrostomy done, or any gastrostomy tube has been put.
He has got a peg, doctor, and he also has a Ryle's tube.
Oh, he has a rice tube?
Yes. And
Okay.
they're trying, probably they put that to keep the esophagus open, but we don't use that. We give him his feed through the peg.
So I think at one stage, one point, you will probably need to remove the larynx, because once the patients cannot swallow their own saliva, they aspirate. And
Yes.
it causes a lot of aspiration issues like pneumonitis.
Yes.
And this causes a serious condition also.
Yes.
So at one stage, you might have to discuss with your treating team that includes your surgeon, who is going to be the main person who is going to take care of his problem now.
Doctor, our doctor suggested lymphatic drainage massage to see if the swelling would come down.
Oh, lymphatic massage can help in reducing the swelling on the neck, but I doubt it will help in reducing the problem in the stricture.
Okay. Okay.
So that is where you need. So easy aspirating, easy coughing frequently.
He is coughing. He's very uncomfortable at night because every time he has to get up to throw the mucus out.
Yeah. So this is a situation where the cancer is cured, but the treatment modality has caused a lot of morbidity.
Yes.
And
Yes, doctor.
this is what I was saying, that we need to select our patients well upfront, whether they will respond well to chemotherapy and radiation. If we feel that they will not likely to benefit, we upfront advise them to undergo surgery, because it gives them a good quality of life. As Shrenik is alive, and you can see he can eat and speak well with the electrolarynx. The problem is doing surgery in such patients after chemo radiation is very tricky, and is a lot of complications involved. So you have to be very careful when you take this decision.
Doctor,
So
can we come to you for help?
You can
absolutely.
definitely, yeah, you can
Yes,
come here.
absolutely. Yeah. I mean, you can, Ms. Kaushik, feel free to get in touch with me. I will be more than happy to coordinate everything for you. And
Thank you.
sir, I would like to add one point here. 26 years ago, I had the same situation like what she has explained, and in my say, I am not a medical professional, but yes, I had experienced this. I mean, catastrophic situation 26 years ago, particularly severe breathing problem and so on. So at times, it's better to lose vocal cord than losing the precious life. I mean, of course, they have to take their own independent decision, but this was my concern when I was asking this question for treating stage 3 and stage 4 patient with the radiotherapy and chemotherapy. So probably surgical option is a better one, but of course that is to be decided by the oncologist and patients and caregivers.
Sometimes what happens, Shrenik Bhai, is that the surgical team or the medical team or the whole treatment team gives an option to the patient. And sometimes the patient also is important in decision making. The family is also important, particularly if they are educated. If their profession
Absolutely.
is, say, something like a teaching or a marketing professional, then for them, a natural speech is so important for them. And sometimes they opt for it. But they should understand, and I'm sure the treating team would have explained to you everything about the pros and cons of undergoing treatment either by surgery or by non surgical options.
To tell you, sorry for interrupting, to tell you very frankly, they suggested that they may have to do this. But my response was, doctor, please try and avoid, because we are at an age, my husband's 79, I'm 75, that it's very difficult to manage like Mr. Shah is managing, you know. And my husband has been in the Air Force, he's been a pilot. So for him, it was a shock, where, especially when the voice started going. And
Yeah.
coming to terms with it is very difficult.
Yes. So, laryngectomy, I would say, is not a debilitating surgery.
Hmm.
It's the disease that is debilitating. We
Hmm.
need to treat them appropriately, either with surgery or by chemoradiation. Anyway, I wish you all the best for your husband, and you feel free to talk to Shrenik Bhai. He will help you.
Definitely, doctor. And if we can make it to Ahmedabad, we'll be there with you.
Sure. Anytime.
Thank you very much. Thank you very much.
Any further questions from anyone?
I'd like to add, doctor, they have suggested to do high baric oxygen therapy also.
Yes. So, hyperbaric oxygen is known to help some patients. Whether it will help your husband or not, we don't know. Nobody will know. But there is no harm in trying that. You can take maximum 40 sittings probably, and you can try that in Delhi and see if that is helping him.
All
But
right.
but you have to be pretty sure that there is no viable cancer before you start hyperbaric oxygen.
Okay. And how does one do that?
Your surgeon or your clinician, your treating doctor would be able to guide you. They would examine him clinically, do an endoscopy if required, and do a PET scan. And if all the reports are negative, probably that is the time when you can think of taking a hyperbaric oxygen.
Thank you so much, doctor. Thank you. God bless you.
Thank you.
Sir, I would like to, I mean, very briefly, I would like to mention here, since we have explained very well in details about laryngeal cancer. See, I must mention to all other listeners that, think of taking the smart decision when, you are diagnosed with the laryngeal cancer. Of course, when you are unable to speak, when you are unable to convey naturally, it is really causing catastrophic situation. Personally, professionally, and socially and emotionally. But then you need to take smart decision of survival as against loss of natural voice, and that's how you can make things happen. And I must say that laryngeal cancer is really not the end of the life. Of course, you need lot of courage, confidence, and family support, and so on. So you have to take individual call. And these days, the genetic oncologists, they are doing wonderful job, in laryngeal cancer. In India and abroad. So, sir, I think this is all from our side. Vaishali, please check if there is any question from anyone.
Mr. Shah, could we have a recording of this?
Yes, You will. I mean, I will ask Vaishali to share with you, or you can get in touch with me. I will be more than happy to share with you Facebook and YouTube link in couple of days. Don't worry. And you have my number. You can check it out and feel free to get in touch with me. I will be more than happy to do whatever best is possible from my end. And these doctors, I mean, they are for me. These people are like my second home, and they will be more than happy to assist in whichever manner is required. So don't worry.
Thank you. God bless you.
Ma'am, the recordings are
Thank you.
available at Facebook, at ICS Delhi Facebook account, and YouTube pay in next 2 days will be available.
Thank you. Thank you very much.
Vaishali, it's 2 minutes past 7, and if there is no further question, then we can wrap up the session. Toprani sir, anything else you would like to add?
No, I thank you all for inviting me, and you all are doing a great activity, creating awareness for people and guiding them and making them aware about the common cancers. These are preventable cancers. If every one of us in the society contributes in creating more awareness, I am sure after 1 decade, this will show good results and the incidence of cancers in our country will go down. More importantly, I want to give one message through you all that early detection is the key to achieve higher cure rates with less morbidity and less mortality. And please make your relatives, family, close family, friends, and relatives aware about this menace and at least make them go and see a doctor and try to help them to quit tobacco.
Thank you very
Thank
much,
you.
sir, for your valued guidance and aligning with what you said in last few minutes. This is the key purpose of taking this initiative by Indian Cancer Society Delhi branch to address hereditary cancer as a priority. And friends, do join us on next Tuesday, 6 p.m. We will have one more oncologist available to share the experience, expertise, and answer your question. Thank you once again, everyone. And Dr. Nisam, thank you very much for your valued time and sharing knowledge and expertise. Thank you so very much. Truly appreciate it.
Thank you,
Thank you.
doctor.
Thank
Thank
you.
you, Shrenik sir.
Thank you so much.
Bye.
Thank you very much. I just wanted to add that my husband doesn't drink, smoke, or eat gudka or pan. So these were the things you mentioned basically, but even then he has got this.
Yeah, I mean, I never smoked, I never consumed alcohol, and I'm a strict vegetarian. So, I mean, I rather would like to salute the dedication of your husband to our nation. So, don't worry, everything will be fine. I mean, we
Thank you
will
very
do
Sometimes,
our best
sometimes,
to.
sometimes passive smoking also contributes in laryngeal cancer. So that is one thing that we must keep in
Absolutely.
mind.
Yes.
Okay. Bye.
Thank you
Thank
very
you, sir.
much. Thank you very much.
Thank you.
Bye.
Thank you. Bye,
Bye
everyone.
bye.
Thank you.
Bye bye.